I wanted to put this video together to really explain how I think about the rotator cuff and a lot of the different things that go into how we treat and deal with rotator cuff pathology. Specializing in shoulder, rotator cuff pathology is the number one thing I see in my practice. So when someone comes in and their shoulder is painful and giving them problems, at least 70% of the patients that I see, the rotator cuff is part of the problem that they're having with their shoulder, right? So the first thing I want to explain is, what is the rotator cuff? Like, what is it actually in and of itself? Well, the rotator cuff is a group of four muscles. You have in the front the subscapularis, on top the supraspinatus, as well as the infraspinatus, and then in the back you have the teres minor. And if you look at the rotator cuff, we have a nice model here. You see it's basically four muscles that encapsulate the shoulder joint. So you have this ball and socket joint here that's very, very mobile. That's why I love the shoulder. It has tremendous amount of motion, but that motion comes at a cost, right? There's instability and it requires a lot of moving parts to keep this system working well. And the rotator cuff is vital to that. So you have these four muscles that encapsulate this ball and socket joint. You've got, we like to think of it as a golf ball on a tee, right? So you have a golf ball on a tee, and those four muscles basically stabilize the system, right? So that's really the job of the rotator cuff, is to keep the ball on the tee. As you move your shoulder through space, it does a wonderful job of keeping the joint stable and still allowing you to have a massive range of motion. So when someone comes in and they have a painful shoulder, and we determine that the rotator cuff is a source of the issue, and that can be a lot of things. It can be tendonitis, it can be small little partial tears, or it can be large tears, and then everything in between. But a lot of patients, the reason why their shoulder is hurting is the rotator cuff is dysfunctional, right? So it's not doing its job, either because it's torn or it's just inflamed or weak. And so when people say, when someone comes in and we look at their shoulder and they either have an MRI, or for me, I use ultrasound in the office to diagnose most rotator cuff pathology, and we say, you have tendonitis or you have a tear. A lot of times when people have a tear, they say, why did this happen, right? Why did this happen to my shoulder? I didn't have a fall or didn't have any big traumatic event. Because 90% of rotator cuff tears are chronic, right? It might even be higher, 95%, just depends on the practice, but at least 90 to 95% are chronic, meaning the tendon just over time just wears out and tears. And people, patients always want to know why this happened. Well, the analogy I give is, have you ever seen, someone go bald, right? Well, there's people that go bald, men mostly, go bald in their 20s and 30s. And some in their 40s and 50s, some in their 60s and 70s, and 80s and 90s, right? So if you were to go to like a nursing home and see a bunch of 95-year-olds, you'd see more bald people than if you went to the high school, right? Look at people's skin. Look at the way that someone whose skin who's 100 years old looks compared to someone who's 25. And this is just happening across our lives. Our bodies age, and as we age, we get less blood flow to the tissues, right? Our tissues decrease in the amount of elasticity they have, the ability to stretch and return to the same level. And they also decrease in the ability to heal. All of our body is made of cells that are generating tissue, collagen, and different things. And the ability to turn that over and keep regenerating and deal with the stresses of moving and using our bodies with life becomes less and less, right? So I know that sounds kind of morbid, but that's the truth. So as we age, if you look at huge populations of people, and we've studied this extensively, the percentage of rotator cuff tears go up, right? So if I were to go ultrasound a large number of people that were in their mid-90s, 70 to 80% of them would have tears in their rotator cuff, right? And then as you go down in the decades, it becomes less frequent. Well, there's people that unfortunately get the short end of the stick genetically, and their shoulders are designed in a way where the rotator cuff wears out faster, right? So a lot of it's genetic. It's what's in your genetic code, and you can blame your parents a lot of times if you have a rotator cuff tear if you're younger, in your 30s or 40s. But really, it's just the natural aging process, and then our bodies just wear out over time. And the rotator cuff, because of the stress that it sees and how important it is, when it does wear out in a lot of patients, it generates a very painful shoulder, and that's why you come in to see us. So once you come in to see us, and we do our exam, we look at all of our imaging, and we determine that the rotator cuff is the source of the problem for your shoulder, the vast majority of time we begin with conservative treatment. And conservative treatment for me almost always involves some form of physical therapy. And patients want to understand, a big question I get is, if I've got a tear in my rotator cuff and you're going to send me to therapy, how is that going to fix my problem? Because it's not going to heal the tear. And that's correct. It's not going to heal the tear, right? Once this tendon tears off bone, it doesn't go back unless the surgeon puts it back. And anybody who tells you different, I would go see someone else. But so what is the therapy doing? Well, often, patients have a tear in part of their rotator cuff. And let's say you have 4 muscles of the rotator cuff and you've got a tear in one. And the most common one to have a tear in would be the supraspinatus, but you can get tears in all 4. Well, you've got 3 other rotator cuff muscles that are still attached. And if we strengthen, the other parts of the rotator cuff that are still attached to the humerus, we can compensate or cope for the part that's torn, right? And right now, walking around on Earth, there are over 1 billion people who have tears in their rotator cuff who have absolutely no idea, because they have a shoulder that has been able to kind of compensate and cope with that over time. And we think some of this is how quickly the tendon's tearing. If you get a rotator cuff tear and it progresses across 1 to 2 years versus 30 years, your shoulder has more time across 30 years to be able to kind of deal with the tearing and strengthen the other muscles, kind of on a subconscious basis without you knowing. But if your curve is fast, right, and your tear is progressing quickly, well, then your shoulder, it can't catch up. Like, it can't balance itself and strengthen on its own. So we want to give it a little bit of help. We want to do some therapy. So therapy is very effective for the treatment of rotator cuff tears. A lot of times I'll ask a patient, what percentage of normal is your shoulder, right? And 100% is perfectly normal, 0% is worthless. And I want to know what range you're at. And what range we see is it varies wildly. But if we can get patients into the 80s, a lot of times with physical therapy, they choose not to have surgery for it. And we can do that if you look at the data, and this has been my own experience. I would say 50+% of the time, at least, we can get our patients kind of over the hump and get a functional shoulder with just doing physical therapy. The other 50% of the time, it doesn't get their shoulder to that 80% mark where we want it to be, and they choose to have it fixed. Other things that we can do to treat, in addition to therapy, are cortisone injections and PRP. I don't love cortisone injections for rotator cuff tears, because if you think about the way cortisone works, it blunts the inflammatory process, which is great because it decreases pain temporarily, but it can weaken the tissue, it can weaken the tendon, and so it can accelerate the tearing of the rotator cuff. And more importantly, if you're someone that has a rotator cuff tear and then you go to therapy and then you don't get better with therapy and we go operate, the data is very clear that patients who have had several cortisone injections have worse outcomes with surgery. Because what we're trying to do in surgery is go in there and get that tendon fixed and get it to heal to bone. Well, we put something in your shoulder that stops that process, right? So it's very, very clear, and there have been several papers that have come out in the last 3 to 4 years that have shown that patients who have multiple cortisone injections in their shoulder preoperatively have worse outcomes. So I have shied away from doing cortisone injections. I still will do them in certain patients, but I prefer not to. I really prefer to stick with physical therapy. If we're going to do some type of injection, I would prefer to use something like PRP. There is good data to suggest that PRP can work well in situations where there's tendonitis or maybe a partial tear. In a full thickness tear, the data is so-so. So it's an individual basis, and we can have a discussion about that. PRP is where we spin down your own blood and inject a high concentration of platelets in and around the tendon, right? So, and that's more in patients who are kind of in a tweener zone and have failed physical therapy and want to try something, short of an operation. And the downside of PRP is the cost. Honestly, that's the biggest downside. It's $400 out of pocket in our practice, and insurance companies do not cover it. So that's the big, and it's also not healing the tear. It's decreasing the inflammation, but doing it in a way that doesn't break down the tissue. So I'm more open to that. And then so in patients who do go through physical therapy for at least 6 weeks to 3 months, and I think you need to do at least 6 weeks, and then we kind of follow the trend to see how you're doing. If you're making zero progress, well, then we can talk about the next step. Or, if you're continuing to make progress with physical therapy, I tell everyone, continue to ride that as long as you can. As long as you're making progress, we should continue doing what we're doing. There's going to be a point when the therapy stops making your shoulder better. And if that's a perfect shoulder, then why would you ever have a surgery, right? But if you're still having a lot of pain despite physical therapy, then it's time to consider having an operation, right? And the operation is arthroscopic rotator cuff repair for me. And what we do is go inside your shoulder with a small camera and we anchor the tendon back down to bone. And this model actually has a pretty good, if you can see here. So what we do is we set little anchors inside the bone that grow into your bone, and we take the tendon. This tendon in the front is kind of torn. You can see this here. And what we do is we use these little anchors to reattach the tendon back down to bone. And your body will heal that back down to bone. Often we'll smooth down the acromion, and very commonly the biceps tendon, which runs kind of right around the rotator cuff, is torn or frayed. We'll fix that as well. It's outpatient arthroscopic surgery. It takes about 35 to 45 minutes to do the whole procedure. If it's a very large tear, it can take over an hour. It depends case to case, but I always tell patients around 30 minutes to an hour is how long the procedure takes. You come in, go home same day. Typically we give you a nerve block to help with the pain post-operatively, and then we give you multiple pain meds to help kind of get you through that first week or two, which is kind of the roughest part. The restrictions after rotator cuff repair are very commonly having you wear a sling for the first month, but I still let you kind of function with your arm down here. I just don't want this for about a month. And then the big things are no heavy lifting, more than a pound or two for about 3 months. And the reason why is when we repair a tendon back down to bone, if we stress it too soon, it'll pull off, right? So we want to just take it easy for about 3 months. We start physical therapy right after the operation, and we continue that on for about 4 months post-op. After 3 months, you can start to lift with your shoulder. But full recovery from rotator cuff repair surgery is around 6 months to a year for most patients. And the reason why is, we've got to wait 3 months to let the tendon heal and then another 3 months to strengthen it. So it is a fairly long recovery process. And that's why we try everything conservatively we can to get your shoulder fixed before we go down that path. Fortunately, it's a relatively good path in terms of outcomes. I track all my outcomes on a database, and across the board, 95% of my patients are very satisfied with their shoulder, meaning when they look back, a year after the operation, they're very pleased with the result they got. They're very happy that they had the procedure, and their shoulder is much better than it was before the surgery. Let's talk about, okay. So another question I get with patients is what happens if I don't get surgery, right? So you told me I have a tear in my rotator cuff, doctor. We did physical therapy. It's doing okay. I don't want to have an operation. Is something terrible going to happen? Well, your rotator cuff tore across time, and it could continue to tear, right? But it's not going to increase in size or width dramatically without you knowing, right? So as long as you're doing okay, you're doing okay. We don't fix rotator cuff tears prophylactically in most patients. There are unique situations, but the vast majority of time, if you're doing perfectly fine and you're happy with leaving your shoulder alone after physical therapy because you have minimal to no pain, then there is very little harm in leaving that tear alone. And if it does start to grow in size, then you'll be perfectly fine. And it tends to be the smaller tear range, right? In tears that are 1 to 2 centimeters, the data has shown very clearly that it's perfectly fine to watch that patient and let them continue to live their life without operating with 0 consequences. Now, if you have a tear that's a larger tear that's retracted, right, you can get irreversible changes in the muscle and the tendon that are difficult to reverse. But again, those are special situations that we can talk about. The vast majority of medium to small size rotator cuff tears, if you do great with physical therapy, there is absolutely no problem with continuing to watch and wait and see how that does. And the tear is not going to increase in size or become something that we can't fix without your symptoms changing dramatically, right? So if you're doing great and your shoulder starts to really hurt, come back in and see us and we'll evaluate. I also think that it's important for you to continue to strengthen your shoulder with all the exercises that you used in order to get you where you are now. I'm a big proponent of diet, exercise, healthy living. If you've had shoulder problems or in the past and you've done physical therapy and it fixed the problem, well, you should continue to do that as a maintenance to continue to keep your shoulder on track. And it doesn't need to be a ton of therapy. It just needs to be you doing a home program 2 to 3 days a week, 10 to 15 minutes. That's all you need. And so that's pretty much it. I mean, that's kind of how I think about rotator cuff tears. They're really, really common. It's a huge part of my practice. And again, we try to treat everybody conservatively. And if we succeed in that, that's awesome. If you're still having a lot of pain despite undergoing an operation or despite undergoing physical therapy, then it's time to consider having an operation. And you never need to have an operation on your shoulder, by the way. I mean, it's not I tell all my patients, it's not cancer, right? I mean, it's a serious problem. You're here because you're having a lot of pain, but nothing horrible is going to happen to you if you don't have this operation, other than your shoulder maybe staying the same. So we do have a great solution to fix it if you fail physical therapy, but if it's your shoulder and you decide what you want to do, and I'm here just to guide you and kind of give you advice on how to fix your problem. So that's how I think about rotator cuffs, and hopefully we can get your shoulder fixed either way. Thanks.